Welcome to the Grow Your Practice podcast. Hi, I'm your host, Chad Madden, owner of Madden Physical Therapy and Breakthrough. Join me each week as we dive into the best practices, systems, principles, tips, and tricks to help you grow your private practice.
Welcome to the Grow Your Practice podcast. I'm your host, Chad Madden. This week, I wanted to share with you a recording from a recent webinar that I hosted. Remember, this was a training hosted with a live audience, so there are real-time questions and answers that I think you will find valuable. Without further ado, let's get started. I hope you enjoyed this episode. In our time together here, we're going to talk about disappearing profits, and really what we're looking at here is surviving Medicare cuts. With more cuts on the horizon, we won't know until mid-November what's really happening for 2024. But right now, there's a 3.3 to 3.6% cut proposed on the table. And we're going to talk about what that means for our practices. And the one thing that I hear most often is something along the lines of, I feel like I'm working harder for less money. And I'm included in this as well. I feel the pressure, but what can we do about it? That's what we're going to talk about here. So in our time together here, we're going to talk about disappearing profits, understanding what's happening and why. Where's the gradual pressure coming from over time? We're going to take a look at how this impacts us both in our business lives and also our personal lives. We're going to talk about a profit leak audit. This was groundbreaking for our practice. We did it about 3 or 4 weeks ago now for the first time. I then went and I was in Denver, shared this with 70 or so other practice owners. And when I looked around the room, everybody had their eyebrows raised. And I asked, has anybody ever done this before? And they said no. So completely new way to look at what's happening with our revenue. I'll be sharing that with you here in our time together. We're also going to talk about the 4 profit levers and what you can look at once you do the profit leak audit to move your practice in the right direction and help weather any other declining reimbursements that are coming our way. We're going to talk about barriers that commonly get in the way and how you can overcome that. And then we have a special announcement, and we'll open up for Q&A at the end. Quick housekeeping. If you have any questions, make sure you find the Q&A tab, type it in there, and then Andrea will hop on here and help moderate any questions that you might have here at the end. So let's start with understanding what's happening and why. Ooh, I think we got out of order. There we go. So the root problem is shrinking reimbursements. So I went to the cms.gov website. I plotted out every single year since 1991 of the physician fee factor, the physician fee schedule, the conversion factor, which determines essentially how we're reimbursed by federal payers. So I did it for the last 30 plus years. This is what it looks like. Fairly level. As a matter of fact, if you forecast ahead for 2024 and the proposed cuts go through, will actually be less next year than we were more than 30 years ago. 1994, I was a high school junior. I was volunteering. I was shadowing in my first PT clinic as a junior and really deciding that I wanted to become a PT. So the reimbursements have stayed flat, if not on a slight decline over all this time. The problem is there's no adjustment for inflation at all. Oh, looks like we lost that. So right now, the average practice is below 10% in profit margin. In his book, Simple Numbers, Big Profits, Greg Crabtree is a CPA that I've worked with in the past. He wrote this really great book, and he's primarily service-based businesses. And in the book, he talks about a great business, service-based. When we look at their profit margins, they're 20% or above. The new break-even in today's numbers is 10%, and anything under that is on life support. So there'll be a poll coming up right now. How's your profitability? Are you doing great at 20% or more? Are you doing well today? So it should be a poll coming up on your screen. There it is. You're doing well today, but you're concerned about the future. You feel the pressure. You're stagnant or break even, which is that new 10%, or profits are shrinking and we're on life support. So just click on one of those, whichever one best describes you. And we'll give it another 5, 4, 3, 2, 1. Great. And I'll share the results here. All right. So 74% said we're doing well today, but concerned about the future. 21% said we're stagnant or break even. So most of us fall into one of those two buckets. Nobody said, 0% said we're doing great, over 20% profit. And then 5% said we're on life support. So thank you for participating there. Looks like we're all in about the same spot. I'm right there with you in our private practice as well. So we have stagnant reimbursements, specifically with the conversion factor and the physician fee schedule for federal payers. And the idea here is if you were getting $84.30 for a visit of physical therapy in 1994 and $1994, you're getting $84.73 today. Right now, yes, changes in certain CPT codes and stuff like that, but this over all of these years is a whopping 43% raise. And next year, with the proposal and the proposed rule, that same visit that was $84.30 is now going to be $81.93. So that's $2.37 less than it was 30 years ago. And wanted to talk about inflation here. If we go so this graph in front of you on your screen shows what has happened since 2000. And you can see pretty devastating effects of inflation. If we go the whole way back to 1994, when we're taking a look at this stagnant reimbursement across the board, what has happened is the value of the dollar today is worth less than half of what it was 30 years ago. And in 1994, a gallon of gas was $1.15. Today, it's $3.93 on average. Median price of a house in Texas was $76,000. Today, it's 5 times that, $352K. The Medicare conversion factor was 34.61. Next year, it's proposed to be 32.75. So we have this downward pressure on reimbursements. A visit today is worth less than half of what it was when we factor in inflation compared to 30 years ago. So downward pressure on inflation, or downward pressure on reimbursements, revenue into our practice, upward pressure on costs. And in the end, most of us are left with declining, shrinking profit margins. Quick introduction here. My name is Chad Madden. I'm a private practice owner, physical therapist, co-founder here at Breakthrough. In the last 10 years, I've had the honor and privilege to work with over 2,000 owners here in the US, all 50 states, Canada, 11 other countries internationally. Been a practice owner since September 2nd of 2003. Currently, we have 7 locations, 9 million in rev, a little over 100 employees, and we just had a valuation done 4 or 5 months ago at 20.8 million. Also host the Grow Your Practice podcast, and I've taught many courses over the years with owners, killer marketing. You can see the other courses there. So really wanted to focus on profitability right now because it's easily the number one most common problem that I've seen in the last 10 years when I'm talking with owners. I myself, literally, we're working through this in our practice right now. And my promise to you is over the next hour, we're going to give you a simple and clear path that you can follow to increase profitability so that you and your team, you can get paid for what your services are worth, not allow somebody else to dictate what your services are worth. You'll learn about I'll share the 4 profit levers that I'm using and that we're working through. And I'll share, I've already tested this a little bit with other leaders in the marketplace. And they said that we're spot on here. So this is what we're doing, sharing it with you so you can start thinking through what strategies do I need to implement here so I can survive this. And when you implement, you'll have more financial security, more financial freedom, and more flexibility to hire and retain top talent, which is another big problem that we have in our industry today. So let's talk about, I did an introduction of who I am. I'm going to guess you're in one of these 3 areas. So 1, you're an established practice owner, and the main thing that's happening here is shrinking profits are jeopardizing your legacy and value. You're growing. So you've been in practice for a while, your shrinking profits are jeopardizing your growth, maybe you've compromised on, we were going to open another clinic, not going to do that now. We were going to hire another team member, we're not going to do that now. We were going to expand to another service, we're not going to do that now. So you're jeopardizing your growth. New owners, you're in practice for less than 5 years, and this is now you know what you've gotten yourself into, and shrinking profits are jeopardizing your survival. So if you can go to the chat and just say what you are, established, growing, or a new owner, that'd be super helpful and help me throughout the rest of the process here so I can make sure I'm talking with everybody. Kathy, established. Kimberly, growing, exclamation point, awesome. New owner, established, growing, established and growing, established, grow. Oh, Chris said two there. Hey, Chris, how you doing? Established over 20 years, established and growing, established, growing with poor profit. Thank you, David. Thank you, everybody. All right, so we just talked about disappearing profits, what's going on. We talked about inflation and a static, if not gradual decline in the conversion factor. The next thing that we're going to do here is take a look at assessing how this impacts us both personally and in our personal lives and our business lives as well. So pull these quotes from talking with other owners. Top one here, I want to be working on my business, but I can't. I'm back treating 40 plus hours a week. We just lost another therapist. I can't compete with what the hospital system pays. I'm already not paying myself what I'm worth. Now it looks like I'll have to pull money out of my own pocket to keep my business afloat. Subsidy is a very real trend that we're having. Personal subsidy to the practice to keep it open. We're hearing that too often. We're going to open another clinic, but it doesn't feel like the right time. And the last one here on your screen, I thought as long as we provided high quality of care, we'd stay busy and we'd be valued in the market. Guess I was wrong. And when we break those down and put them into buckets, there are a few big problems that jump out of the quotes here. Number one is we have a time crunch. Big problem number one is we have a time crunch. We don't have time. We're forced to work in our business versus working on our business. We might want the benefits of being able to work on our business, have a practice that provides some financial security, financial stability, not only for us, but for our team members as well and our families. But we don't have the time to work on our systems and work on our team building as well. The big problem number two is we can't compete with the healthcare system salaries. I've been through this. I mean, we went through the interview, 3 hours of interviews with, they were well into the process with a prospect. And they said, listen, I can go out in the marketplace right now and make 67% more than what you're offering. And that really put us in a bind. And I know I'm not the only person with a story like that right now. And I said, great, where is that at? They won't answer, but I said, then, you should take, if you have an offer for 67% more, and that's what's important to you is working, for more money, then you should take that position. And never heard from them again. But yeah, I mean, this is a real issue for us right now. And I'm sure it is for you on the call. By the way, just if anybody's experienced that in the last 12 months, just put problem number two or the number two in the chat, just so I know that I'm not alone. Big problem number three is we're delaying expansion. So thank you, Elizabeth. Now I don't feel alone. Great. So delaying expansion. Hey, we were going to open up another clinic and now we're not. We're going to wait for the right time. Or we were going to expand an existing clinic. Now the timing doesn't feel right. Now we're not going to do that. We were going to hire another team member. Now we're not so sure about doing that. So this is another big problem that we hear. Big problem number four is giving outside forces like insurance company U or insurance company A. I'm sure you can infer who I'm talking about. We give them control over how valuable we are in the marketplace. And that also creates a big problem as well. And most of us aren't willing to walk away as of right now, which creates even more problems for us. So that's how it affects us. Disappearing profits affect us in our business lives. How does it affect us in our personal life? Again, more quotes here. Honestly, my health and stress levels are not the best. I don't really have time to take care of me. I want to travel with my wife or your partner. I want to do things with my kids and I can't. Forget financial freedom. That's not happening. I don't even need time freedom, although it would be nice. I just want to be able to be present when I'm with my family and not worry about work. Another one here. I have a lot of blood, sweat, and tears in my practice. My family has supported me all these years. I really want to be able to take care of them, travel with my kids, send them to college, do things in the community. The practice is our retirement. How can I make sure it stays valuable, leave a legacy? And this literally just happened to me. So, I mean, like literally within the last 2 hours. Had a friend reach out, happens to be in real estate. And he said, hey, by the way, one of your competitors is having a sheriff sale. And I was like, oh, get out. Who is that? It's it like really hit me. Is another practice owner here locally, friends with. I think he's a great guy and upstanding member in the community for decades. And just went out of business, closed his practice. Pretty devastating that it would come to this. And I remember talking with him a few years ago and right before the pandemic. And, he was talking about everything that he had built in his 2 or 3 locations and protecting that long term. And I haven't had the chance to reach out to him yet, but it doesn't look like the landing was clean at all. So yeah, not good. This is a real problem for us. And I can't imagine how it's affecting him and his children as well. So big problems that I'm hearing, number one is mediocre health habits, very common. Don't have time to take care of me. Big problem number 2 is missing family time. Big problem number 3 is falling short financially. And number 4 is compromising on family experiences or opportunities. And just out of curiosity, same thing here in the chat. Which one of these is your biggest issue? You can just type in 1, 2, 3, or 4 in the chat. Number 1 from Cassie. Stephanie says 3. Chris says 4. Chris in Washington says 3. Melissa 4. Kathy 4. Michael 4. Paul, nice, 3 and 4. All right, so lots of answers in here. Thank you. All right, so this is something else that I know I've done, I'm guilty of, and I've talked with other practice owners about this. But many of us gauge how we're doing in practice as a practice owner. Our scorecard is what happens when we look at our checking account, right? So the example here was, if you were looking, maybe you check on your phone, maybe you check it on your laptop, maybe you have much better intestinal fortitude than I do, and you never check it, or you only look at it once a month. But for most owners, they're checking it once a day or even more than once a day, right? So you look at your banking account and it says $8,328.87. And you have payroll. Today's a Wednesday, or Thursday, you have payroll coming out tomorrow, and your payroll is $25,000. I mean, I can remember when our payroll was $25K. I think now it's $300,000 every 2 weeks. So, but we've all been here, right? You look at the account, you have money coming out. Maybe you wrote, check is in the mail type thing, and you're going to be short. So now you're panicked, you're scrambling, and you're feeling a little bit, at least on some level, resentment or feeling like failure as an owner, right? Like, what am I doing wrong? All right, just pause that for a second. On the other end, we have $25,000 in payroll coming out, and we look at our account and we say, okay, we have 97K in there. We're going to be fine, right? And just think about how you feel when that happens, right? You get that little dopamine hit. Yeah, everything is okay with the world. Sky's not falling. We're fine, right? And again, same thing. Which feeling is right? I don't know. I've had both, and one of them is pleasant, right? And I feel good about myself, even if I'm not performing 100%, an A+ as a practice owner. And on the other end, I feel like a failure, right? So I think for many of us, this is what we're doing. We're taking a pulse on how well we're doing as an owner, how well our practice is doing by looking at the checking account balance. There's a little bit better way to do that, and we'll talk about here. But I'm going to make an assumption that your aim here, the reason that you showed up, is that you want to increase profits so that you can keep your doors open, you can help more people with your services, and you can build a more valuable practice. And whether you measure that value in goodwill within the community or dollars and cents, I'm assuming it's one of those things. So having said that, we talked about the problem. We talked about how it affects us. So where do we start as we're thinking through this? The choices are overwhelming, right? There's so many things out there in the marketplace right now. We could renegotiate rates, and we've shared that with, and really my role is, I was thinking about this morning that I'm very thankful for, but for the last 10 years, I get to talk with owners all over the country, and I get to find best practices. So, we talked with Tony and Melissa Sear down in Gainesville, Florida, how they renegotiated rates and they have a 12% increase. A lot of work behind that, a lot of work behind what they did, but that's an option for us. Do we drop a low payer, or do we go out of network? Like we had, Bob Kowalik on our calls in the past talking about how to do this, and we've had owners implement this as well and do it in their practice. Do we focus on that? Do we add a cash pay service? And we've done a lot of work with light force laser, et cetera. I mean, that's exactly what we're doing in our practice. Do we emphasize that more? Do we add RTM? Do we hire? Do we bring in more people? Do we downsize? Do we cut expenses? Do we implement some sort of complex scheduling and billing system? What do we? There's a lot of things going on. Most of us are time starved. So how do we pick the right choice, the right strategy for our practice, or do we put a mediocre effort into doing, all 12 things at one time? Anytime that we make a change in our practice, and if you haven't written anything down yet, this is something that you're going to want to write down. Anytime that you make a change, especially when you're working on your business, not in it, but anytime that you make a change or you're updating a process, you first want to look at the baseline. You should never make a change without doing that first and taking a look at what is actually happening. As scientists, what we learned to do was take a look at the control first before we try to hypothesize and test something different than the control. So it's not fair, right? The situation that we're in, yes, we can write letters. I think the other year our practice sent over 1,000 letters for the proposal, still went through, right? Yes, we can, organize a colossal effort, but for the most part, there are easier things for us to control. Yes, you should do advocacy, but where do we start? We must focus on what we can control, and especially control more easily, more realistic for our area of the world. So the next thing that we're going to do here, so we just did assess the business and personal impacts. Now we're going to talk about the profit leak audit. So again, first time I did this might have been a month ago, 3 or 4 weeks ago. Started sharing this with owners. One is the breakthrough owners on a monthly call, went through this. I did it last week in our clinical director training call, and I at our last live event with 70 owners shared this. And this was the one where everybody had their eyebrows up. As I looked around the room after I shared it, everybody had their eyebrows elevated and looked like a deer in the headlights. Here's some what a couple owners have said. I know Pratik sent me a message, said that he had done this. It's a completely eye-opening situation. I always thought that one of his clinics was the ideal clinic, but I don't know where and when this underbilling culture starts. So he found some issues in his billing. Sean Weatherston, Boise, Idaho, added a new PT 3 weeks ago. His schedule, that is just anyhow. Sean implemented the simple audit, and what they found was exactly where they're losing revenue. I believe the one thing that he noticed was cancellations and no-shows are a killer. So this is the first one that we ever did. This was in my practice. So some confessions, I've never been in our EMR. Yes, I'm a licensed physical therapist. I haven't treated in 5 years. We have Raintree. I've never opened it up. I was in our old EMR med end, but nonetheless, had to sit down with our CFO, Tracy. She walked me through. We created this spreadsheet. It took us 36 minutes. I was pretty much watching, but walking through like what to do. So I said, Tracy, pick any date. And we were trying to evaluate in our practice, do we want 30-minute appointments, 45-minute appointments, or 1-hour appointments? And which one is the best? And we were doing lots of forecasting forward. And I said, let's take a look at what's happening in the clinics right now. So I said, pick any clinic. She chose June 5th. Now, the first thing that you want to do is you want to go back at least 60 days. Why do you think you want to do that? Why do you think you want to go more than 60 days? You can throw it in the chat. Claim is processed. Exactly, Michael. Yep. The exact revenue coming through. So we went through, we did that. All the claims have been processed except one there. You can see 3:00 on this day. The claim was denied. But we did rebill the right insurance the next time. So we were waiting for that. But nonetheless, on the visit, so we went to 8:00. 8:00 was a no-show, right? So reimbursement realized for that hour, 0. We go to 9:00. We had 2 Medicare visits. I'm going to assume one of them came in early. We also have a floating PTA, so maybe the PTA helped. Not sure. $73.80 for one visit, $82.60 for the other. That to me looks like $156.40 on the hour. 10:00, $72.49. 11:00, $100.05. Anyhow, we worked throughout the entire day. Right. The reimbursement on the day that we realized was $798.72. We may get another $80 in there, so let's call it $880. Now, the question is, what did you see there? Right? What realizations did you have when you looked at our numbers? And this was the most important thing. So it's not filling out the sheet, but it's asking yourself better business questions. And would you say, how do you know whether we're doing good or bad? So if I was one of your therapists and that was my treatment day, did I do good or bad on that day? What do you think? You can type that in the chat. All right. So did fair. So here's so this is a 10-hour workday for us. We know that our rate on the hour that we've written our business plan, the assumption is $107.50 is our hourly rate. That's what we built our entire business model on. Our break even, so just literally covering our expenses, is somewhere between $85 and $87 an hour. So on this day, as it stands right now, we lost money, right? Not good. We can't have many of these. And what they quickly do is anywhere in our company with 50 plus providers, anywhere that we have profitability, right, a cushion, a safety of margin to continue operations, anywhere that we have that, these little losses, $50 a day, $100 a day per provider, they eat away at that profitability. So not good, right? And then we went through here and we talked with the therapist and we just said, what do you see? And he was like, cancellations kill me. And I was like, yeah, absolutely. So the way that what we did next is we rolled this out with all of our directors and they each went through and did their own schedule. Most of them are, I'd say all of them are master clinicians and highly productive and efficient. So they didn't have a lot of cognitions there. When they rolled it out with each one of their clinicians, that's when the changes really started to jump off the page. So, took a look at this, 14 visits scheduled on a 10-hour day, not a crazy workload or anything like that. 37 units billed, again, less than 4 per hour. So nothing crazy here, but you can see where we're at. We made some corrections. The therapist that I did this with, or did this for, that Tracy and I did it for, he went back and started auditing his own stuff, made immediate corrections just because he was looking at it himself. So this wasn't like a top-down thing where we were telling him what to do. So yeah, 4 missed visits, absolute killer. The other thing is unless we're doubling up, our outcome from this is like, okay, what else can we do here? We have all these other options. I mentioned cash pay, changes in scheduling, RTM, et cetera. Where should we go from here? It always starts with the baseline. So, what you can do is we can share a link where you can copy the profit leak audit, the template, and do it for your practice. Thought I had the QR code in here. Next up.
This is Andrea. I'm going to share the link in the chat right now.
Awesome. Thanks, Andrea. Yeah. So what you're going to do is with that link, you won't be able to edit that, but if you go into that Google Doc and hit make a copy, you can make a copy for your practice and then do whatever you need to do. So the next thing that we want to do is after we look at the baseline, now we want to start to evaluate the 4 profit levers. And we're going to talk about that next. Again, if you haven't written anything down yet, it's a good time to start writing notes down. So the first thing that we can do is maximize utilization. I know Chris Hicks has in here those 4 missed visits. Yeah, they're an absolute killer. So if we take a look at a very simple model, a practice with 2 PTT, 2 physical therapists, 2 clinicians, they're 80% full. I think our assumption there was 50 visits per therapist. They're averaging $90 per visit in reimbursement, and they're seeing 80 visits a week, right? Because they're at 80%. That's practice A. Practice B, they have 2 PTs, same 2 PTs, same space, same overhead. They're 95% full. They see $90 a visit, and they're averaging 95 visits a week. What's the difference in profit margin between those 2 practices? It's $1,350 a week, or if we multiply it out, $65K a year. I think it's actually $67,500 a year. Pretty big difference, right? Because those missed visits are really margin. And, then we can think about the repercussions and how it affects them. So practice A or practice B, who can offer a more stable working environment to their employees? A or B? In the chat. B, right on. Who can better weather another reimbursement cut? B, right? Who is in a better position to compete when a PT is walking out the door? B, right? Because they have a safety margin of safety built in. So when we talk about maximizing utilization, 2 ways that we can think about that. One is you can fill the schedules of the existing clinicians that you have today. For next week, they should already be full, right? The second thing that we can do is fill the space. So if we have 3,000 square feet and we have 3 clinicians, that's not very, very good use of space, right? Our general rule is 500 square feet gross square footage for every 1 clinician. So in 3,000 square feet, we should have 6 clinicians in that space, right? Seeing 300 visits a week, not 3 seeing 150. You get the idea. The second big thing that we can do, big bucket, is we can increase lifetime patient value. The big thing here, big takeaway is most practices are losing money on their patient list, and that shouldn't be so. The most valuable asset that you have in your practice is most likely your patient list, right? And I mean, event after event, we even teach how to do it, but we'll talk with owners and, are you doing this? The practices that are filling their schedules and filling their space, they're marketing to their past patient list. The practices that don't have time to do it is usually what they say. They frequently have major gaps, major profit leaks in utilization. So your patient list, you should have consistent communication going out, both one-to-many and one-to-one, especially if you're looking for consistent growth. What does that do for you? It gives you more reactivations, more past patients coming in for additional care. You can easily add a cash pay service when you have those marketing channels built in, and you get more word of mouth referrals coming through. Third big bucket is you can improve your payer mix. And we have a very polarizing exchange going, and I'm just watching this in the last 24 hours on social. again, I'm in a role where I get to talk with owners that are doing very unique and remarkable things. And I realize I have a unique perspective on it. So anytime that we see an owner doing something exceptional in the marketplace and they're willing to share their practice, we get it out there to you. We've seen owners put a lot of work into improving their payer mix, and they doing really well with it. Over on the right, there are two owners. Tony Sear went through renegotiation. We've shared the renegotiation template and exactly what he did. A lot of work in between Tony and his wife, Melissa, and the rest of their team. And they were able to increase their reimbursement rates by 12% in about 2 years. Fairly significant. And some of those renegotiations, they actually got 10% annual increases for 3 years in a row. Pretty cool. Sean Weatherston had Sean on these already, and he shared how he dropped a lowest payer and what that did for his practice as well. So 3 things we can do here: we can drop a low payer, usually a cap payer. We can renegotiate reimbursement rates like Tony did and Melissa, or we can track more of your higher payers. To do the third one, literally you could do it today. Go through and attract more of your higher paying patients. Yep. So shared Tony's story, went through, increased his rates by 12% on average from 2020 to 2022. Some other key things here, and I know, for example, I heard an owner saying, well, I just tried to renegotiate with insurance company A, and that didn't work out well at all. And, we were told something along the lines of, we're just lucky to be in network with them. Oh, okay. So then it's move on to the other payers, right? I'm not saying there's not failure along the way. There's absolutely work here. And, again, Tony and Melissa have shared a lot with other owners just to help other owners. But at the same time, behind the curtain, takes a lot of time and perseverance, and no doesn't always mean no. Oftentimes they, swam upstream within the organization. The fourth one here is strategic scheduling and compliant coding. You just looked, I shared with you in that Profit Leak audit, should we schedule every 30 minutes, every 45 minutes, every hour? We know mathematically from Bob Kowalik and the massive amount of data that he's looked at, the optimum time, if you're looking at that, is about every 40 minutes. You get 3 visits in every 2 hours. Seems to be the most efficient. No-shows, cancellations are less painful when they're happening, but you get the idea there. So you can go through strategic scheduling and then making sure that your coding is compliant as well. The one thing that the Profit Leak audits have noted for us is oftentimes we saw our clinicians billing, delivering more service. So they would bill, maybe 4 or 5 units on a payer who's capped at 2 or 3. Right. And that additional care is compromising working with other patients as well. So you want to make sure you're following your practice act, that you're compliant, legal, ethical, everything else. We're going to have, we've worked with Married Along and BCMS sharing how you can do that as the strategic scheduling and compliant coding. So let's talk about next. We're on number 5 here on your screen. What typically gets in the way? 2 big things that we hear. Number 1 is, I don't have time to work on my business. And this is fairly common, right? So here, we just went through this exercise in Denver. Had owners list out every single activity they do, and there were some fun ones in there other than treating, changing the light bulb, plunging the toilet, meeting with my bookkeeper, or balancing the books. Involved in billing. I answer my own phone sometimes. That was one owner said that. And we went through and listed all the activities. The next thing that we did, and that included working on the business activities like strategic planning and staff meetings, things along those lines. Working on hiring, working on, creating more flow of candidates who are applying. The next thing that we did was we put an hourly dollar value on each one of those activities. And it's crystal clear that owners that struggle with time, and I was guilty of this for years. When we struggle for time, most often what we're doing is we're filling our day up with lower value activities. things that are between $20 and $50 an hour, and avoiding the things that are literally worth hundreds of dollars an hour for our practice, right? Like planning, like renegotiating rates, like, looking at how to add a cash pay service, like marketing to fill our schedules, et cetera. So what's unfair, and there's no problem at all if you do that, but if you're struggling with profitability, it's a little bit backwards to think, well, I'm going to do all my work over here in the $20 to $50 an hour activity, but I want this result that I've put all these valuable systems in place, that I have the right team in place, right? And I want the results of that. That it's not in alignment. So you want to make sure that's aligned. That where you're investing your time, that the majority of your time is also the most valuable activities. The second thing here is some sort of like finish line. So I need to fill in the blank first. I need to hire a PT first. I need to hire a receptionist first. I need to hire a billing person first, and then I'll work on my business. And the right question here is, when's it too late, right? Because that increased pressure that we're all feeling right now, you just saw in our poll, nobody on here was willing to share that they were more than 20% profitable. A few years ago, pre-pandemic, the average for the industry was 14.6%, 2018. Now it's under 10%, right? So I think we've waited long enough. The time is now. The urgency is now, in order for us to start working, on our business, on our systems. All right. So we've gone through the audit. That's new. Haven't seen anybody say that they've done that before. So you've got some work to do there. You then have a consideration. The 4 buckets, it really breaks down into 11 or 12 different strategies, and it can feel like you're drinking out of a fire hydrant. So what we've done is we've put together a new program, Profitability Under Pressure. It includes a 13-week masterclass where we go through how to find profit leaks, how to make time to work on your practice, not in it, where we show you how to prioritize your time, how to plan for profitability, how to systematically fill your schedule. And keyword there, system, how to maximize utilization of space, how to market to your past patients and increase the lifetime patient value, how to add a cash-based service, how to improve your payer mix. And this is not only what I'm doing in my practice, which is what our earliest courses were. This is now what hundreds of other owners are doing as well. So we're distilling down best practices and giving it to you in a very condensed masterclass type outline. How to create scheduling strategies and compliant coding to maximize your revenue. And we deliver that online. We include all the templates in that. We have weekly calls with owners. You're not just learning from me, you're learning how other people like Sean and Tony and Pratik and Jennifer and other owners are implementing and winning with the strategies. Because sometimes if you're only hearing it from me, you get, well, my business is different type thing. And we have such an amazing group of owners on who are willing to share. They can help you overcome any barriers, obstacles that you might be having. It's the power of the group, and you get access for your entire team. Now, we're at a critical junction here, and we talked about the masterclass and the new program. And for most of us, it's the frog in the boiling pot of water. And really, you have 2 options. We see the same pressure. When I looked at the inflation, when I looked at what was changing about our reimbursement rates, and we had a fairly big hit because we have a lot of federal payers in our area. Right, I jumped into action. Right, and it's the same thing here. The frog in the pot. If you know the story of the frog in the pot, if you gradually increase the temperature of the pot of water, the frog will not leave and will boil to death, right? So you can sit there and do nothing, or you can jump and take action. So let's talk about what that looks like, because you're going to be joining other owners that are in this together, that are solving this together with you, that are willing to share, like many of the owners you've seen here. So to make this an absolute no-brainer, we have a guarantee. and you increase your profits. So you go through the course, you implement what's in the course, you increase your profits by $10,000 within 90 days of the course completion, or we'll give you a full refund. And again, you just have to I think we've outlined 5 steps that you have to do from the course. Implement it into your practice. If you say, hey, I did this and it's impossible and I'm not more than 10% or $10,000 in profit, I don't have more than $10,000 in profit to show for it, we'll refund your money. Carl and I were talking about this with the team. Again, it's a crucial time. I understand where, the practice is at, being a practice owner myself. So we wanted to make this an absolute no-brainer for owners that really need help right now, right? So we have the course, we have the information, we have the program outlined for you. We have other owners. I believe we already have 11 owners signed up for this next course, and we haven't even gone to early bird yet. So we wanted to make this a guarantee that would be valuable to you as well, and would show that the course is working for you. So guarantee $10,000 or more in profit, or you don't pay. You're gonna save $1,000 off the course when you apply today. You're gonna save your spot. I just shared we already have 11. That's a true number. I just made sure we had the right number. 11 owners already in the course, and we have 20 plus people that have already applied that are in the queue to hop on calls with our team. Plus, you're going to get all the bonus resources, hiring, how to control your time, plus all the other information in the course, the full 13-week masterclass, the most information at the lowest price. So to learn more and apply, go to getbreakthrough.com/apply. Hear what some owners are saying about the course. Varel, awesome new practice owner we met out of Ohio. He was with us in Denver, and his partner Christina. They went from $83 a visit to $98 a visit after going through the course. Peg Gray, private practice owner, 4+ decades, I believe, in Connecticut. Big win. I'm getting my finances under control. Jonathan, biggest win for us is able to renegotiate our contracts with 2 insurance providers. And what will probably be bigger wins in the near future will be dropping our lowest payer and increasing cash-based services to our practice. I can finally see some light. You can see a few more wins there. And again, to learn more, go to getbreakthrough.com/apply.
Remember to visit getbreakthrough.com to access our free resource library designed specifically for private practice growth. While you're there, make sure you register for a complimentary growth assessment to learn about potential opportunities for growth in your local market. Again, thank you for tuning into the Grow Your Practice podcast and supporting our mission to help people in pain get back to normal naturally.